Hi everyone, this is Leonard. I work for SBC's marketing department. Today I'm going to bring you guys a report written by Kiara Ford. The title is Inflammatory Breast Cancer, Breaking Down the Basics. So, among the many different types of breast cancer, one of the least discussed and least understood is inflammatory breast cancer, also known as IBC. This is primarily because of its rarity. IBC only affects 1 to 5% of all breast cancer patients. For those affected, however, IBC can be difficult to diagnose, treat, and recover from. For all of these reasons, it is important to be aware of the symptoms and treatment options of this less common subtype of breast cancer. Continue watching to learn how inflammatory breast cancer is different from other breast cancer subtypes, as well as how IBC is diagnosed and treated. The first section of this article is what is inflammatory breast cancer? Like the majority of breast cancers, inflammatory breast cancer is usually an invasive ductal carcinoma. This means the disease is the result of cancer cells developing from the cells that line the milk duct of the breast and subsequently spreading to cells beyond the duct. That said, the symptoms and treatment of IBC are different from other types of breast cancer. The second section of this article is about how is inflammatory breast cancer different from other subtypes of breast cancer. The key difference in presentation of inflammatory breast cancer is the lack of lymph within the breast and rapid onset of symptoms, including swelling and redness of the entire breast. This inflammation is caused by the cancer cells obstructing the lymphatic vessels of the skin on the breast. The same inflammation is a sign that the cancer has spread into nearby tissues and potentially nearby lymph nodes. Because of the presentation within the skin, by the time IBC has developed enough to be noticed and diagnosed, it is considered locally advanced, at least at stage 3. This development often happens rapidly in a matter of months or even weeks. In a third of the IBC cases, at the time of diagnosis, the cancer has already metastasized to other parts of the body. Now we are at who is at risk of inflammatory breast cancer. Certain populations may be more at risk for inflammatory breast cancer than others. IBC is unlike other breast cancers in that it is more likely to develop in younger people. Many are under the age of 40. It primarily affects women and people assigned female at birth, although all genders can develop IBC. One risk factor is being categorized as overweight or obese on the body mass index, also known as BMI scale. And recent studies suggest it is more common among people of color. Next section is about what are the signs and symptoms of inflammatory breast cancer. Signs and symptoms of IBC are easy to mistake for breast infections, so it is important to recognize and discuss them with a doctor as soon as they emerge. They include, but are not limited to, swelling, discoloration, pain, and itching of the breast. Other skin changes that may occur within days are inverted nipples and thicken and pitting of the skin, which gives the appearance of an orange peel in texture. Swollen lymph nodes under the arm can also be a sign that IBC has spread beyond the breast. If any of those symptoms present, it is important to address them quickly and receive a diagnosis as soon as possible. So, how is inflammatory breast cancer diagnosed and treated? Diagnosis of inflammatory breast cancer typically consists of physical examination, imaging, and biopsy. Once an IBC diagnosis has been officially confirmed, the results of the biopsy can help determine the right course of treatment. People whose cancer cells have hormone receptors may benefit from hormone therapy drugs, whereas people whose cells contains an abundance of the HER2 protein may react better to medication which specifically target HER2. Beyond targeted drugs, other treatment options may include chemotherapy, surgery, and radiation depending on the nature of the cancer. To sum up, due to how uncommon inflammatory breast cancer is, it can often be forgotten in conversations about breast cancer. This information must be communicated and understood in order to help people to know what to look for and to seek medical consultant as soon as possible. That's all for today's information. Thank you for your time.